Hello friends, welcome to my channel Healthy World. Today I will speak about cerebral palsy.
Brain is the most important part of our body. It controls all that we do. Different part of brain controls the movement of every muscle of the body. In cerebral palsy, there is a damage to or lack of development in one of the areas of brain. What is cerebral palsy? Cerebral palsy is a disorder of muscle control which results from some damage to the part of brain. Cerebral means brain, palsy means weakness or paralysis or lack of muscle control. Cerebral palsy term is used when occurred early in life. Types of cerebral palsy: spastic, dyskinetic, ataxic and mixed. Spastic cerebral palsy. This is the most common type of cerebral palsy. Spasticity means stiffness or tightness of muscle. The muscles are stiff because the messages to the muscles are relayed incorrectly from the damaged part of the brain. Dyskinetic cerebral palsy refers to cerebral palsy with abnormal involuntary movement. These are of two types, dystonia and orthosis. Dystonia is a term used for sustained muscle contraction that frequently cause twisting or repetitive movement or abnormal posture. Orthosis is used for uncontrolled extra movements that occur in hands, arms, feet and around the mouth. Ataxic cerebral palsy. This is a least common type. Causes unsteady shaky movement or tremor and also have a problem with balance. Mixed cerebral palsy. Mixture of several of these movement pattern. Causes of cerebral palsy. Causes of cerebral palsy is unknown but some are. Brain malformation. In the early months of pregnancy is exposed to rubella or cytomegalovirus. During labor or at birth had oxygen deficiency. In the period shortly after birth had severe infection. And having accident in the early period of life. Which part of the body is affected, varies from one child to another. Hemiplegia if one side of arm and leg of the body are affected. Also called hemiparesis. Diplegia if both legs are predominantly affected. And quadriplegia if both arms and legs and the trunk are affected. This is also called quadriparesis. How severe is the movement problem? The gross motor function classification system is the method of describing the range of gross motor function in children with cerebral palsy. Gross motor function classification system is divided into 5 levels. Level 1 and 2 can walk independently. Level 3 requires a stick, elbow clutches or walking frames. And level 4 and 5 require wheelchair. Problems faced by the child: problems with hearing, problems with eyesight, epilepsy, gastroesophageal reflux, constipation, nutritional difficulties, bone disease, undescended testis and many more. Cerebral palsy is a permanent condition and problems associated with this condition remains throughout the lifetime. Let's talk about some of the questions which are normally asked. Will the child condition deteriorate? No. Will the child learn to walk? With mild, GMFCS level 1 and 2, will work independently. With moderate, GMFCS level 3, generally walk with stick or walking frames, and with severe, GMFCS 4 and 5, will required wheelchair for more activities. Will the child able to look after himself? The aim of the treatment is to encourage the child to learn to be as independent as possible. Mild cerebral palsy achieve independence, moderate cerebral palsy has slow process, and severe cerebral palsy always need other for assistance. Will the child learn to talk? There are a wide range of communication ability among the children with cerebral palsy. Some will not have difficulty in learning to talk. Some develop speech by the help of speech pathologist or learn alternative method of communication. Will the child develop their problems? Over the course of development, some child develop behavior that are disruptive, unsocial or difficult to manage. Will child have normal life expectancy? Most children are healthy and will have normal life expectancy. Small group of severe cerebral palsy and with condition like epilepsy may be at the risk of reduced life expectancy. Will the next child have cerebral palsy? This is extremely unlikely. Parent must seek genetic counseling from doctor and obstetric care of future pregnancy. What treatments are available for the child? Treatment of the movement problem, treatment of associated medical problem and provision of therapy and early intervention services.
Thank you guys. Please like, share and subscribe to my channel and do comment.